Welcome to a really high-yield explainer that's designed to make you super confident when you're assessing premorbid personality, especially using the new ICD11 framework. We're going to make this practical, clear, and something you can use, like, tomorrow.
All right, let's just dive right in. We're going to follow a really clear 6-step clinical workflow. It's going to take us all the way from the one core question you've got to ask right through to crafting a sharp, exam-ready formulation for your notes. Okay, first things first. Let's start with the single most important question that frames this entire assessment. I'm serious. If you get this right, everything else just kind of falls into place.
So your goal here isn't to just find a label or slap on a diagnosis. It's about understanding your patient's long-standing patterns, how they think, how they feel, how they behave. This is absolutely key to seeing how those patterns are influencing their current illness.
Now for a really important shift. Let's look at why ICD-11 moved away from that old system of categories and what this new dimensional approach really means for you in your day-to-day practice. It's a game changer.
So here's the crucial point. We are no longer trying to force patients into these rigid, often ill-fitting boxes. Instead, we're looking at traits that, everyone has to some degree. We're just asking which ones are the most prominent and how do they affect the patient's life. And honestly, this slide is the key to the whole thing. Just forget the boxes. Instead, picture 5 sliders, like on a mixing board. As we go through these domains, just think about where you'd set the slider for your patient. It's not a yes or a no, it's about the degree.
So what are these 5 sliders? Let's dive into the 5 core trait domains. This is essentially your new clinical toolkit for understanding personality. First up, we've got negative affectivity. This basically captures a person's tendency towards things like chronic worry, anxiety, and just a general emotional sensitivity. It's really about how quickly and how intensely they experience those negative emotions. And this is where it gets really powerful in the clinic. If you identify that someone has high negative affectivity, you're looking at a huge predisposing factor for conditions like anxiety disorders, depression, and even somatic symptom disorders. It's a big clue. Next up is detachment. This describes a person who's often pretty socially withdrawn, they seem to prefer being alone, and they show pretty limited emotional expression. They might not have a lot of close relationships. And this really matters because high detachment directly affects a patient's help-seeking behavior. It can also mean they have a very limited social support system, and it's critical information when you're planning treatment. The third domain is dissociality. This is all about a persistent disregard for the rights and feelings of other people. You're going to see things like low empathy, being manipulative, and a certain kind of callousness. Now, you might see this one a bit less often in a general clinic, but spotting it is absolutely crucial. It points pretty strongly to a potentially poor therapeutic alliance and a much higher risk for non-adherence and other risky behaviors. All right, number 4 is disinhibition. This looks like impulsive decisions, really poor planning, and just a tendency to act first and think later. And you'll see this across a lot of life situations, from their finances to their relationships. This one is so clinically vital. High disinhibition often links directly to challenges like substance use, non-compliance with treatment, and just a pattern of recurrent crises. It explains a lot. And our final slider is anacastia. This is characterized by things like perfectionism, rigidity, a really strong need for control, and a significant difficulty with uncertainty or ambiguity. And this one highlights a common clinical challenge you are going to see all the time. This trait often drives things like health anxiety and that constant need for reassurance. It can also lead to treatment resistance if the patient feels like their sense of control is being threatened by your plan. Okay, so you've identified the dominant traits, you've moved the sliders around in your head. Now you have to do one more crucial thing. You have to confirm that they are truly part of the premorbid personality and not just symptoms of the current illness. Just use this simple 3-point check, both with the patient and with any informants. First, was this pattern there before the illness? Second, does it show up across situations, at home, at work, socially? And third, has it been stable over many years? If you get a yes to all 3, you can be really confident you're looking at their premorbidity personality. And this is where we connect all the dots, right? The entire goal of this assessment is to see how these long-standing traits are actively shaping what you are seeing in the clinic today. This is the so what.
So just remember, personality can act in three main ways. It can predispose someone to an illness, it can perpetuate the symptoms once they've already started, or it can totally shape how that illness expresses itself, both physically and emotionally.
Finally, let's pull all of this together into a single, really powerful sentence. This is perfect for your notes, for case presentations, and, of course, for your exams.
Here is your template. For example, premorbidly, the patient showed predominant negative affectivity with anagastic traits, characterized by chronic worry, low stress tolerance, and rigidity, which likely predisposed to and perpetuated the current illness. A sentence like that is ICD11 compliant, it's clinically rich, and it really shows you understand the whole person, not just their diagnosis.
So I'm going to leave you with this question. Take this framework and just try it out. Your next patient, start thinking in terms of these 5 sliders. It's a subtle shift, I know, but it can profoundly change and improve how you understand the people you're trying to help.